Well, a timely placed advertorial, as we all want lovely, luscious locks to be able to curl them. But hair loss in women is actually quite common and it can be devastating. Dr. Frances Pitzelis joins us now to look at what can cause this and what the treatment options are. Good morning, Dr. Frances.
Morning, Mel.
It's interesting, isn't it? Because you don't necessarily associate hair loss with women. You usually think about balding men, but it is a problem for women, significant hair loss. What are the types and what are the causes?
Yes, it's a real worry. The type that is sort of similar to the male one, they lose it at the front, at the sides, and then they start losing it at the back, and then at the extreme, the whole thing coalesces. Now, with women, it's different. It just starts at the top, right? Just at the top. It gets thinner and thinner and thinner with time, and it's a real worry for women. It runs in families. In women who get this, they call it female pattern hair loss. As opposed to male pattern hair loss, and it's the genetic one. You can look back in these women's families and see that the men are bald. It can start from the age of 40. 75% of postmenopausal women can get this. So that's that sort. Now, the other sort of hair loss can be just from the hairstyle. It's called traction hair loss, braided hair, tight ponytails, that sort of thing. And it can also be from fungal infections. These are far less common. And there's an unusual condition called trichotillomania.
Crikey, what is that?
It's Greek for madness and pulling your hair. It's an anxiety condition.
Right, well, you actually pull your own hair out.
Yeah, you pull your own hair and you might not even know you're doing it.
Wow, that's incredible.
Yeah, so there's that. And I suppose you have to look at underlying conditions to cause these hair losses. Apart from the genetic, you're looking at nutritional deficiencies, vitamin D, vitamin A, iron and zinc. You're looking at hormones. Underactive thyroid is often missed, obviously after menopause, but approaching menopause, you're looking at progesterone and zinc, pituitary, contraceptive pill, and polycystic ovarian syndrome.
Okay, so they can all affect your hair, and so
yeah.
And from what ages? Like any age?
Well, with polycystic ovarian syndrome, it can be from maybe even earlier, but generally, women as early as age 35 can start losing their hair from hormonal conditions, and as women get older, they start to get more thyroid conditions, especially after menopause. So you could have the coalescence of a lot of this. And with polycystic ovarian syndrome, you often haven't got enough zinc and progesterone, and that's what you need to stop testosterone turning into dihydrotestosterone. And that's what causes your hair to fall out, too much conversion. And then in that situation, you've got this enzyme that's very busy, and that can be treated by correcting progesterone and zinc.
Gosh, it sounds so confusing. There's a lot to really be thinking about.
Well, there is a lot. I mean, I've made quite a study of it. The other thing is that you can get autoimmune conditions that are associated with hair loss. And then what happens, of course, is on top of all of that, if you've got stress, that can make it worse because it generally drains your nutrients. But there's a specific condition that's autoimmune and it can be worse with stress called alopecia areata.
Right.
Now, men and women can get that, but more women. I've got a couple of patients who've lost all their hair. All their hair.
Is it likely to come back, or is that it?
Well, I have been able to help them, but typically alopecia areata ends up with chunks of bald patches on your head, and men can get it in their beard. Really distressing for women.
It would be particularly distressing for women because we all think of it as our crowning glory, don't we? Of course. So what about skin conditions?
Yes, some skin conditions can be associated with it, like atopic dermatitis of the scalp and rare skin conditions. And what you need to do is go to your doctor. Your doctor will check that you're not taking any drugs. I mean, there are some blood pressure medicines that can make your hair fall out. So check that you're not on any drugs that are contributing. Check your hormones, check your nutrients, do the tests for autoimmunity, and probably refer you to a specialist if needed.
Right.
And then apart from that, you can get minoxidil foam or solution in the chemist shop.
What is that?
It makes hair grow. It was originally a blood pressure drug, and when the women were getting hairy, they investigated it. And so then they I decided to put it on the scalp.
So hang on, so when we're talking about the hair, we're talking about it grows on your head.
Yeah.
We don't want it growing anywhere else.
No, but the women were getting bodily hair, you
Okay.
see, so they thought, no, this is no good, so we'll just investigate it for scalp hair.
For shampoo.
Yeah.
What else can you do? I mean, what can you be looking at?
You've got to look at contraceptive pill. That can be helpful in younger women. Pills that are blocking the androgens, the male hormones. Believe it or not, you know the finasteride that men take to stop their hair falling out. Smaller dose, you give it to women.
Okay.
Same stuff. And then there is a medicine called spironolactone, which stops testosterone production. You can have platelet-rich plasma treatment from your own blood, which helps your hair cells to grow. And ultimately, you might have to look at hair transplants.
Okay. Can you just explain to me a little bit more about that platelet-rich plasma? I've heard of it being used in facials and things, but how does it work on the head?
Well, it's been researched in the alopecia areata and the male and female pattern baldness, and it's been shown to work. It's taking your own blood and spinning it to get the platelets out, and then you inject into the scalp, and then it stimulates, well, it reduces inflammation and it stimulates the stem cells in the hair to grow.
Wow, it's fascinating.
And after 3 treatments, you get very good results.
It's a lot to think about.
It is a lot to think about.
Dr. Francis, thank you so much. Always enlightening, always learn so much too. And if you are concerned about anything that we have discussed this morning, please contact your own healthcare professional.